Good afternoon. It's Dr. Nancy live from Florida today. We have a different background behind me. We may have some internet issues. I'm in a hotel room. The internet is not that great here, but we're going to get through this. So today I'm so excited because we have Sergiy Druganov. He says it way better than I do. He is a homeopath here in Indianapolis, and I had the pleasure of meeting him actually a few times. I really admire the work he's doing. So what he's going to do today is going to tell us a little bit about homeopathy, and if you have any questions or comments while you're viewing this video today, go ahead and comment below, and we'll try to answer them. If you have any comments or questions after this is over, and put them in there, we'll make sure that he gets them and we can get them answered for you. So welcome. Sorry about all the technical problems. I appreciate you being here today.
Thank you. Thank you for having me today.
Thank you. So, Sergiy, tell us a little bit about your background. I find it really interesting.
Okay, so my background is I graduated as a medical doctor in 1997. Originally, I'm from Ukraine, and Ukraine, our health system is slightly different from American. And when you go to medical school, at the very beginning, you have to choose which kind of doctor you want to be. So I have chosen to be a pediatrician. So from the very first year, I was in the pediatrics. And it was my main subject, major for all my years in medical school and then in residency. I graduated in 1997, and at the same time, when I went to residency, I took my first course in homeopathy. Yeah, at the time, in our countries, all these alternative holistic treatments were very popular, and it was interesting. I heard about good results with homeopathy, and also I found one old book, and I was reading it, and I found, oh, this remedy sounds like describing all my... At the time, I had some issues with chronic tonsillitis, like sore throat quite often, and I was reading the book, and wow, this remedy just exactly describes my symptoms. And I have taken a couple of doses, and my chronic tonsillitis went forever. And it was just so unimaginable, impressive. And I decided to learn homeopathy. In countries like my country, Ukraine, Russia, and all these ex-Soviet Union countries, people still believe a lot in alternative and holistic medicines. And you can even see that they are afraid of conventional treatment. So almost every family has some home remedies, and before going to the conventional doctors, they will try different home remedies, modalities, and many of them would first go to the holistic doctor. And they understand if someone has heart attack or stroke, yeah, it's the right time to rush to the hospital. But when it's chronic issues I don't know, chronic bronchitis, asthma, eczema, people would go to see herbalist or homeopath or acupuncture doctor. And also one different thing in our country is that if you want to work with people's health, if you want to practice acupuncture, homeopathy, herbalist, or something else, first you must be a medical doctor. No one can practice any modality if he is not a medical doctor. So everyone, if you are looking even to the holistic alternative path, first you will go to regular medical school, you will get your MD diploma, and then you can practice whatever you want to practice. And I work in a big homeopathic clinic in Kyiv. Kyiv is the capital of Ukraine. And we have been seeing all types of patients, many acute cases, pneumonia, appendicitis, bronchitis, everything. Inflammation of ears, eyes, all kinds of cases, psychiatric cases, because we were licensed medical doctors. We were allowed to see everything, and people believe a lot in homeopathy, and we had great results with all these pathologies. After moving here and starting my practice here in Indianapolis 3 years ago, of course, my practice changed a lot. Yeah, and probably I would like again to see all these acute cases, but now I mostly deal with chronic cases. And also I would compare that probably in Ukraine, 90% of my practice was, we would say, like bodily physical complaints, like normal disease, yeah. And here almost 80% of my practice is more mental, emotional issues. So anxiety, sleep problems, autism, spectrum disorders, and all the things, which was very little part when I practiced in Ukraine. So after graduation, I went to the residency. After residency, I worked for a couple of years in the children's hospital. And then I went to work in my medical school. I was professor of clinical immunology and allergology for almost 5 years. But all this time, I was already practicing homeopathy. And then after 5 years, I decided that I cannot divide in between conventional medicine and homeopathy. And I went completely into the homeopathic practice. And so I can say now that I was in homeopathic practice already for 20 years. Yeah, because last year we celebrated 20 years after our graduation. Yeah, homeopathy, it is old standalone therapeutic system. It was developed by the German physician Samuel Hahnemann more than 200 years ago. It has proven its efficacy for all these years. And Hahnemann, he was a very interesting person, and he has seen things far beyond. And probably he was the first one who started doing clinical trials, because he told that we cannot learn anything about medical substance only by the way proving it on healthy people. So he was taking a group of healthy volunteers, giving them substance and asking them to write down all the changes they were experiencing. So not on sick people, but on healthy people. He wanted to learn this way how this substance works on healthy body. So you can say clinical trials started 250 years ago, and the father of clinical trials was Hahnemann. Another thing is psychiatry, because at that time people still used very barbaric treatments for psychiatric patients, and they still believe that people were just possessed by devil or something, doing holes in their head to leave the devil go out, and doing all other very painful torturing methods. And Hahnemann was the first one who told, no, these are normal disease like all other disease. And these people are normal people like all others. And he wrote books and like teaching people that you should be very kind with psychiatric patients. They are people suffering a lot, and they are not possessed by devils. Yeah, so again, like he was kind of father of this humanitarian psychiatry. And he treated a lot of psychiatric patients. Idea of homeopathy, the main root is that we are not dealing with consequences of something. We are not dealing just with symptoms. We go to the roots of the problems. Yes, we use symptoms, like classical homeopathic consultations consist of interview and then observation, assessment. And by this, we try to understand how healthy vital force changed and what is going on now. And based on these observations, because Hahnemann used to say that symptoms, it is the language of vital force. Only by symptoms we can know disease, not mental speculation, no our ideas, no our meditation or thinking, but only what we can observe from the patient. It's the way how we learn disease, and the same way how we learn remedies which we can use for this disease. So homeopathy is very individualized medicine, because prescription is based on the set of symptoms. Not only one symptom. Someone will come and tell me, I have headache, give me a remedy. I will not be able to do it. Or, for example, like now it's like flu season, cold season, how you will call it, like winter season. comes, yeah, and someone will say, I have flu, give me a remedy. No, I cannot do it. Yeah, I need to ask symptoms, like, do you feel chilly or you feel hot? Like, I should look, is his skin is red or pale? Is he thirsty or not thirsty? And it will tell me what remedy he needs at this moment. The same with chronic conditions. Person will come with a high blood pressure, just one complaint, I cannot give a remedy. I will ask about everything. I will ask his medical history. I will ask his background, his family medical history, because all these things matter. And 10 people with high blood pressure will come to my office. All 10 will live with different remedies, because it's very different from conventional medicine. There is no remedy for the name of disease. There is only remedy for the person. And everyone's high blood pressure is different. Everyone's headache is different. Everyone's asthma is different. Different factors affect it, different factors trigger it. And so it's treating not disease. We use symptoms of disease, but we treat person. We don't treat the name of disease. We don't, like someone comes like, can you treat worms? Yeah, or like some microbes, herpes virus, and like, how you know that your worms are sick? We don't need to treat them. Like, it is a host problem. We need to treat you. Why worms find that your body is perfect terrain for them to grow? Something wrong with your body. It's not with the worms. It's not with Epstein-Barr virus or cytomegalovirus or any other virus. So a homeopathic approach, it's very individualized, going to the roots of the problem. In some cases, in some modern societies, it can be things like, oh, it's probably not as effective because someone goes, like, has high fever, cold, or flu. He suffers because of all this malaise in the body, like some achiness and other things. He goes to CVS, buys fever medication, and in 10 minutes, he feels 80% better. But from homeopathic point of view and from holistic alternative point of view, we know, and like everyone who took some courses in physiology, he knows that fever is produced not by microbes or virus. It's produced by our immune system to kill viruses and to kill microbes. And high fever is because we produce a lot of interferon gamma. It's what brings fever up. And so when you give a remedy to lower your temperature when your body is supposed to fight with the pathogens, you kind of just block immune system. Yeah, you feel better, but virus can do whatever it wants to do. And we have trials which say that using fever medications increase your chances of having complications of the disease. So homeopathy will not work this way. If someone has flu, I will give a remedy. He will feel better, but his temperature will not become normal temperature when there is a time to fight with the virus. So he will better tolerate, less complications, less side effects. Homeopathy is very safe because we use extremely low doses of substances. It cannot cause allergy. It cannot cause side effects. It's safe in newborns. It's safe in pregnant women. It can be used in animals, in elderlies, in everyone. You can eat, like, if remedy doesn't fit you, if you just take any random remedy, so it has no affinity to your physiology, you can eat 5 pounds of remedies and nothing will happen. It will work only if it was properly chosen according to your set of symptoms. So homeopathy helps our vital force to operate in most efficient way, to work with the roots of the problem, with underlying issues, and probably something you inherited from generations. And now you have these predispositions for sore throat or repeating ear infections or other things. And we can work with all these layers, what happened in your life, what you inherited through the genes from your parents, and with all these layers to kind of elevate, to improve your level of health and make you more healthy person, make your immune system more efficient. And I would say that probably homeopathy is one of very few approaches which can really heal chronic disease. not just alleviate symptoms, but really heal. Like over time, like someone comes with bad asthma, we can go through a series of remedies. It can take 1, 2, 3, 5 years, even in some cases. Yeah, it's not magic. Yeah, so it's hard work. But in 5 years, he's free of asthma for the rest of his life. It's not like taking inhalers for the rest of your life. Yeah, it took a time. It was not easy. We needed to change remedies, change remedies, change potencies, different regimens of taking remedies. But finally, we have healthy human being. Yeah, it's not temporary effect. Something changed very deeply. So it's the way, because when I worked for Department of Clinical Immunology, Allergology, I was writing my theses, and my theses were uncontrolled asthma in children. And so I wrote a letter to all these outpatient departments in my city asking to send to me all kids they cannot manage with asthma. Yeah, so they give them conventional treatment. There is no improvement. And I was working at the same time I started to learn homeopathy, and I started to use homeopathy. And it turned out that homeopathic remedies were more effective than all these inhalers and remedies available at the time. It was like turning point. I decided, wow, it's safe, no allergy, no side effects, and it helps a lot.
And like that, you take care of the host, and not the symptoms. That's awesome.
Yes, yeah. I think it is the most important thing.
I agree, yeah.
Yeah.
So this is kind of an off-the-wall question, but how is the health of the patients you're seeing in America versus the Ukraine? Is there a big difference?
Yeah, it's what I mentioned in the beginning. I see more mental, emotional issues. When people come for interview, an initial visit, it lasts up to 2 hours. So I want to know everything about them to choose a proper remedy, because now in our pharmacopoeia, we have about 4,000 homeopathic remedies. And you will need one remedy which will work for you. So I need all these small details. And people here, in many times, they have difficult time to explain their sensations. They come with headache. I ask, what type of the pain? And usually I hear 2 responses, sharp or dull. Okay, can you tell me more? Is it like, no, it's dull. Like, it feels like what? It is dull. And like different types of pain, it will tell you different remedies. Because like I said, okay, can you try to describe it? Is it pressing? Is it compressing from outside to inside, like tight band around your hair? Or is it kind of bursting, like pressure from inside outside? Or is it stinging? Or is it like, there's so many different types of the pain. And my conclusion, maybe I just like what my experience with patient I saw here, people kind of losing their connection to their body. Yeah, so they don't feel what goes on in their body. They're completely in their mind. And also from homeopathic point of view, from philosophy of homeopathy, when disease go from like outside to inside, from less important to organs to more important, from physical complaints to mental, emotional complaints, it means deepening of pathology. It's more difficult disease. It's more deep-seating disease. It is disease which is much more difficult to treat. So I was from homeopathic point of view, I would say that all these not developed countries like Brazil, Russia, Ukraine, all these countries, people are healthier. Are healthy because they mostly come with normal physical pathology, pain here, hurts a little bit here, and they can't describe symptoms. Because also it always when you try to understand prognostically how successful can be this case, when you see very little physical symptoms, no modalities, no peculiarities, person cannot describe them, it means that like body is dull, nervous system is suppressed, and it tells you even if complaint is very little, you understand it's very deep-sitting pathology. You cannot expect miracle cure in 1 month or 2 months. Yeah, it will be hard work, and it's very serious thing.
Natural healthcare, natural healing, it takes time and patience.
Yeah, it takes time. It takes time, but we are talking about different things. We talk about healing with natural healing, and we talk about managing symptoms with conventional treatment. Nothing gets better. You are not improved. You are not healthy. You just don't feel your symptoms. Yeah, for example, high blood pressure. You go to the conventional doctor. I just say conventional. There are many perfect, like very good conventional doctors, but I mean just like standard conventional attitude. You'd go with high blood pressure and you get the medication which will lower your blood pressure. And with homeopathy, no, person comes and you understand somehow there is a reason body wants this pressure to be higher. What is the reason? What for? And now we have research, like, I mean, not homeopath, but like conventional research, which says that people who were taking blood pressure medications for a long time, they are more predisposed to dementia. You can easily understand that someone is aging, vessels become not as elastic, not blood circulation to the brain is not as good as it was before. They are not elastic. They cannot adapt all this volume of blood. And so, but brain is suffering. Brain is not receiving nutrients, oxygen. What body does? It increases blood pressure to bring more blood to the brain, to improve circulation. And if you at this point give someone high blood pressure medications, you artificially block receptors. Pressure becomes perfect. It stays like normal range, but brain is suffering. It's just one example, yeah. So treating holistically and just managing symptoms, it's different things. But in acute situation, homeopathy works very fast. Like someone with the flu, acute symptoms, just dying, extreme symptoms, he takes 1 sip of diluted remedy, and in 15 seconds, he will say, I feel better. Right away. So the more acute situation, the more faster homeopathy works. So in chronic cases, you need time, and it's explainable. Like if there's trauma for connective tissue, for all cells to replace with the new cells, it takes 1 year. So you cannot turn ligaments heal in 1 month. It's not possible. It's physiologically not possible. But in acute situations, you take the remedy and you feel change right away.
Well, you provided us with a wealth of information today. I really appreciate it. How would somebody get a hold of you?
They can go to my website, which is www.homeopathic-touch.com, and they will see all information about me, about my services, and also they will see a button, schedule an appointment. It will bring them to my schedule. They can pick up the time which works for them better, or they just can call me 317-426-8855, and we can talk. I can schedule appointment for them. They can just Google my name and Sergiy Druganov on Google, and there is only one Sergiy Druganov in Indiana. They even can Google classical homeopathy, and I am the only one in Indiana practicing classical homeopathy. And we have a couple of, when I moved here, I was trying to find colleagues who practice homeopathy, what we call kind of real homeopathy, and I didn't find anyone. And we have like Center for Council for Homeopathic Certification, National Center for Homeopathy, and when you go to the register and you search for someone in Indiana, I'm the only one. Yeah, so kind of I have no competitors. But at the same time, people know very little about homeopathy. If you go to California, you see hundreds of practitioners. If you go to New York, Boston, you see hundreds of practitioners, not in Indiana.
Well, we'll keep you busy.
Yeah, yeah.
Well, Sergey, thank you so much for coming on. Sorry about the audio.
No, it's fine. Yeah, it's fine. As I was talking most of the time, so I didn't need to hear you.
Yeah, they can hear you good. It's me that has a problem,
Yeah.
from what I understand.
Okay.
So thanks again for joining us today, and have a wonderful rest of your day.
Thank you very much for inviting me. The same to you and to all your listeners.
Thank you.
Yeah. Thank you. Bye-bye. Bye.